Welcome back to Open Mind. Today, we're diving deep into a topic that affects many people but is often misunderstood: trauma. Trauma is a powerful and complex experience. It can stem from a range of events, from a single distressing incident to prolonged exposure to stress or violence. Understanding trauma is crucial for our mental and emotional well being. So let's break it down. Trauma can be classified into different types: acute trauma, which results from a single distressing event; chronic trauma, which is repeated and prolonged, such as ongoing abuse; and complex trauma, which involves exposure to multiple or varied traumatic events, often over a long period. Trauma affects us in many ways. Physically, it can lead to symptoms like headaches, fatigue, and insomnia. Emotionally, it may cause feelings of sadness, anger, or anxiety. Mentally, it can affect our concentration and memory. But trauma doesn't just impact the individual. It also ripples out, affecting relationships and families. Trauma can strain relationships. For instance, someone who has experienced trauma might struggle with trust, communication, or intimacy. This strain can lead to misunderstandings and conflicts within the family. Recognizing trauma and its effects is the first step toward healing. Support from loved ones, professional counseling, and self-care are all important parts of the recovery process. Remember, healing is a journey, and it's okay to seek help along the way. Trauma is a deeply impactful experience that can have long-lasting effects on an individual's mental, emotional, and physical health. Here's a more detailed look at trauma and its facets. Types of trauma. 1. Acute trauma. Results from a single, isolated event that is distressing or harmful, as a car accident, a natural disaster, or a violent attack. 2. Chronic trauma involves repeated and prolonged exposure to distressing events, as ongoing abuse, physical, emotional, or sexual, living in a violent or unstable environment. 3. Complex trauma involves exposure to multiple or varied traumatic events, often over a long period, leading to significant cumulative impact, as prolonged childhood abuse, long-term domestic violence. Impact of trauma. Physical effects like chronic pain, fatigue, headaches, gastrointestinal issues, disrupted sleep patterns. Emotional effects like persistent sadness, anxiety, anger, mood swings, emotional numbness. Mental effects like intrusive thoughts, flashbacks, impaired concentration, memory issues, dissociation. Behavioral effects like increased risk-taking behavior, substance abuse, withdrawal from social activities, difficulties in relationships. Trauma and relationships. Impact on relationships. Trust issues. Trauma can lead to difficulties in trusting others, affecting personal and professional relationships. Communication challenges. Individuals may struggle with expressing their needs and feelings effectively. Intimacy issues. Trauma can result in difficulties with intimacy and emotional closeness. Family dynamics. Strain on family. Trauma can place significant stress on family dynamics, potentially leading to conflict or breakdowns in communication. Role changes. Family roles may shift as members try to cope with the trauma, potentially leading to additional stress. Healing and recovery. Professional help. Therapies. Trauma-focused cognitive behavioral therapy, TFCBT. Eye movement desensitization and reprocessing, EMDR, and other trauma-informed therapies. Support groups. Engaging with others who have experienced similar trauma can provide comfort and understanding. Self-care. Mindfulness and relaxation. Techniques like meditation, yoga, and deep breathing can help manage stress and promote emotional regulation. How to help someone who has experienced trauma? Helping someone who has experienced trauma can be challenging but profoundly important. Here are some practical ways you can offer support. 1. Listen and validate. Be a good listener. Offer a safe space for them to talk if they want to. Listen without judgment or interruption. Validate their feelings. Acknowledge their emotions as real and important. Avoid minimizing their experience or telling them to move on or get over it. 2. Provide emotional support. Be patient. Understand that healing from trauma is a process that takes time. Be patient and avoid pushing them to talk or act before they're ready. Offer reassurance. Let them know you're there for them and that they're not alone. Consistent support can be comforting. 3. Encourage professional help. Suggest therapy. Encourage them to seek help from a mental health professional, such as a therapist who specializes in trauma. Offer to help find resources or even go with them to appointments if they're comfortable. Respect their autonomy. While encouragement is helpful, respect their decision if they're not ready to seek professional help. 4. Help with daily tasks. Offer practical support. Trauma can impact a person's ability to manage everyday tasks. Offer help with things like running errands, cooking, or other daily responsibilities. Assist with organization. Sometimes trauma can make it difficult to manage responsibilities. Help them with planning or organizing if they need it. 5. Promote healthy coping strategies. Encourage self-care. Suggest activities that can help them manage stress, such as exercise, mindfulness, or hobbies. Support them in finding healthy ways to cope with their feelings. Avoid triggers. Be mindful of their triggers and try to avoid situations or conversations that might exacerbate their distress. 6. Educate yourself. Learn about trauma. Understanding trauma and its effects can help you provide better support. Knowledge about trauma responses and coping mechanisms can be beneficial. 7. Respect boundaries. Honor their space. They may need time alone or have specific boundaries regarding their trauma. Respect their need for space and avoid pushing them to share more than they're comfortable with. Be mindful of their comfort. Understand that certain actions or topics may trigger their trauma. Always ask for their preferences and respect their comfort level. 8. Encourage connection. Foster social support. Encourage them to connect with supportive friends, family, or support groups. Social connections can be an important part of the healing process. Be inclusive. Invite them to social activities or gatherings if they're interested, but understand if they prefer to decline. 9. Be aware of your own limits. Seek support for yourself. Supporting someone through trauma can be emotionally taxing. Ensure you have your own support system and consider speaking with a counselor if you need help managing your own feelings. 10. Practice empathy. Show compassion. Approach them with kindness and empathy. Trauma can affect behavior and reactions, so understanding and compassion can make a significant difference. By providing understanding, support, and encouragement, you can play a vital role in helping someone navigate their trauma and work towards healing. Thank you for watching. The most important thing is to make sure to subscribe because there's more great content on the way.